Today we're going to talk about the CHI performance exam that CCHI administers for interpreters of Arabic, Mandarin, and Spanish languages. My name is Natalya Mytareva, and I am a CCHI Executive Director. I was one of the founding commissioners of CCHI and was privileged to follow the creation of our examinations and programs from the very beginning. That's why I will be talking in detail maybe about some things that you may not find that interesting, but all of these pieces of history it could explain why the exam is the way it is. Let me start with a very brief introduction about CCHI, although I know many of you on the webinar already know about us, but still for the newcomers, we're the national certification entity, a nonprofit corporation, 401c6 organization that has a mission to administer and develop national, valid, credible, and vendor-neutral certification for healthcare interpreters. All these four concepts are very important for us, and the most important ones, of course, are valid and credible. And because we really want to make sure that our exams measure what healthcare interpreters do on the job every day, and they are developed and maintained in a very appropriate manner. CCHI's examinations are called in the testing industry high stakes examination. In other words, they're not an examination after a course, which are low stakes, right? They are examinations based on which some hiring decisions could be made in our industry. For example, if you're certified, you have more chances of being hired, right? For that reason, we have to follow certain procedures to maintain the level of integrity of the exam. And that starts with the fact that when we decide what is part of the exam, we have to base it on data. And that data comes from the National Job Task Analysis Study, a survey that we conduct every 5-6 years. Our first job task analysis was conducted in 2010, the second one in 2016. So the exam that I'll be describing to you today is based on these two job task analyses. They both confirmed the main elements that the exam needs to have if we want to test if a person could interpret in healthcare settings. The certification that we're talking about today, we call CHI, Certified Healthcare Interpreter, and this is language performance certification. In other words, we're testing not your knowledge, but your actual ability to interpret, and we do it in 3 languages, Arabic, Mandarin, and Spanish. To become certified at the CHI level, you need to pass 2 exams. The first one is the written exam, which is exactly the same as for the CoreCHI certification, that 100 questions, multiple choice in English. That's what I talked about last week on the webinar, and it's available now on our website. Today, we'll talk about that second exam that you need for your CHI certification, the oral performance exam. Before I dive into the content, I want to clarify that we're really proud that when we created our first exam, it was CHI Spanish, naturally, because the majority of interpreters in the industry are Spanish speakers. We made sure that we are seeking a third-party review and approval. So for that reason, we accredited our CHI Spanish exam with the National Commission for Certifying Agencies, NCCA. This is the accrediting body that reviews certification exams for different professions, and to make sure that they follow the best practices for both the organizations and the actual psychometric aspects of the exam. With the CHI Spanish exam was first accredited in 2012, and then the accreditation is good for 5 years. So last June in 2017, we got reaccredited for the next 5 years. We also as I already mentioned, have two other exams, Mandarin and Arabic, which have been built and follow the same procedures. They have exactly the same content. They undergo the same monitoring by the same psychometricians as the CHI Spanish exam. But because both exams are a significantly lower volume, they don't provide what we feel enough statistical data for us to seek accreditation of those exams independently. So as soon as we see the higher volume in those two exams, we will seek accreditation of those. But again, as I mentioned, the content, the structure, how the rating is done, how the raters are trained, the review that we undergo are the same for all three exams. And that's why we often talk about the CHI exam without specifying the language, because we're referring to its structure and policies. With that said, I wanted to give a brief overview of how the exam is created, or how the exams are created. Because of CHI Spanish being accredited, we have to follow specific steps, as I said, and some of these steps directly relate to how we write the content for the exam. NCCA accreditation standards demand that all items are written by subject matter experts in the field of practice, and in our case, that will be healthcare interpreters. In other words, we could not have somebody who is not practicing interpreter create items. I'm personally, by education, a professor of English and Russian interpreting and translation. As such, if I were not a practicing interpreter, I could not write this exam. This is not the exam written by academics or by managers of interpreters or by medical professionals. This is the exam that is written by practicing interpreters. Another requirement that NCCA has is that each panel of these subject matter experts must represent the characteristics of the population to be certified. In other words, of the currently practicing interpreters in healthcare. And those characteristics are: we speak different languages, we work either as staff or freelancers, we work in different settings, from hospitals to clinics to public health, for insurance companies. We work in different modalities, face-to-face, over the phone, video, remote. We have different level of education, etc., etc. And for that reason, when we create or convene these panels of subject matter experts, we make sure that each panel, which goes between 7 to 15 people, different stages, different numbers, but each of these panels is a microcosm of our profession. And the reason why we have this diversity of interpreters writing the content is to make sure that we do not have any kind of undue or disproportionate influence of any specific group or individual. If, for example, we'd have only interpreters who are hospital staff writing our content, then obviously there will be more content pertaining to hospital, right? And even in hospital, there are adult hospitals, there are children's hospital. So for that reason, we really look at many, many characteristics of each interpreter who volunteers for us to be content writers. The other important thing is all these subject matter experts are volunteers. They're not paid. They don't have any vested interest in a specific topic or specific way of creating an exam item. And then because we understand that being an interpreter doesn't make you a good writer or creator of an item, we make sure that our subject matter experts are trained in how to write items, how to edit them, and how to validate them. And when we go through the validation process, here we're looking at each item and we answer a set of questions, mainly geared towards one concept: that any interpreter of any language working in any settings who is competent to work in healthcare settings will understand this item and will be able to successfully interpret it in the time that we provide on our exam. So that's how the validation is worked. So there are several sets of panels, not one, but at least three. Those who originally write, those who review, and then the final one is the language specific panel, who make sure that not only the wording of the content is correct, but the timing of the on the exam that we allow you to record your interpretation is also correct. In other words, a minimally competent interpreter is able to interpret that phrase within the allotted time. The process of developing the exam is pretty complicated and complex. And the reason I'm telling you this, so that you understand that there are no random things there. And we really try to make this content reflect what you hear on the job. As I mentioned, we start with the National Job Task Analysis Study, a survey. The last survey was responded to by over 2,000 interpreters, and their results created what we call exam specifications. In other words, the weight and the value of certain segments on the exam. And I'll talk about that in a second. After that, after we have the exam specifications, we start our item development and validation process in English. So that first panel that we convene to write the items for the exams has interpreters of different languages on it. So there is no content that would be specific just for Spanish or just for Arabic interpreters, because these exams have the same content, the same foundation, meaning for sight translation, that English panel, the first panel selects English documents from healthcare and just certain paragraphs that they select for the exam. If it is simultaneous or consecutive items, they will write everything in English and have that item validated that it is appropriate for the entry-level interpreter and not for advanced interpreter, for example, and that item doesn't have any cultural bias or any bias towards an interpreters who are full-time versus interpret only several hours a week. After that process is done, which is actually several meetings taking at least, if you put it in hours, I would say that would be of hours of people meeting will probably take 2 days. But because these item writers work also remotely, it's many more hours goes into that initial stage. After that, we convene 3 different groups: Spanish interpreters, Arabic, and Mandarin, who then adapt and translate that content into their language. What they do, they actually make sure that the speech of the patient sounds natural and colloquial, meaning fluent, conversational, in Spanish or in Arabic or in Mandarin. And then they propose the correct interpretation or possible mistakes for interpreting segments which are done from English into Spanish, Arabic, and Mandarin. So they go through the validation process. That also takes, because we're doing it remotely via conference call meetings like similar to this webinar, it also takes a couple of months to go through this process for each language. After that, our psychometricians are present at every step of this process, in addition to CCHI staff. Then our psychometricians help us construct this test forms. And again, we want to make sure that out of all the items on the exam, we represent different specialties, that we are not creating an exam with about cardiology, right? If we're saying it's healthcare interpreting, then we want to make sure that we include as many specialties as possible, and that they don't, they're not biased, a form is not biased towards one specific specialty. Then we have the raters training, because raters need to agree on what they consider the correct interpretation right? That's easy because we all know what's right. They should agree on what is definitely an incorrect interpretation of certain speech or dialogue or a text. But then the hardest part becomes when they need to agree on specific scores in between, right? Because unfortunately, we have very few perfect interpreters who do everything right and produce the perfect interpretation. We have very few interpreters who produce a completely wrong interpretation because those individuals simply don't apply for our exam, right? So what we deal is with that big variation in between, and that's what raters training is about, that they all agree as a group how they're going to rate this deviation or that. To give you an example, if you have candidates who omit certain sections in their interpretation, the raters need to agree, like, for example, that omitting the word thank you pretty much doesn't have any effect on the score, right? Because yes, it's incomplete, but if everything else correct in the grand scheme of things, we all understand that every interpreter knows how to say thank you in their language, right? But if the interpreter omitted on the exam and in real life, of course, something like you need to take this medication with food, and they omitted the word with food, then that is a gross mistake. Because it impacts in real life, it will impact the patient's safety. And even though we also understand that every interpreter knows how to say with food, the point is that the interpreter didn't understand the importance of that message by the speaker and didn't interpret it. So omissions, in other words, have different values to raters. And so with raters, when they are trained, they go through this process several times to make sure that they're all on the same page for what they give one score, for what mistake they give a lower score, and how low, etc., etc. And these recalibrations, the initial training, they undergo on the new content, but then before every testing window, they go through this process and slightly different variants and versions to make sure that testing is done for each candidate as objectively as possible. Scoring, and also as standardized from one testing windows to the other as possible. After the rated training is done, then we administer the exam and score the exams. Then we review the exams. We review them on an annual basis. We run different kinds of analysis about how the items are performing, how the raters are performing, how they agree with each other, and all that other aspects of monitoring that the exam is performing the way it's intended to perform. In other words, the main purpose of the exam is to distinguish bilingual individuals who are able to competently interpret and those who cannot. And then if necessary, we adjust, and then when we do the next job task analysis, we go through the same process again and again. So I want you to understand that this is a very iterative process and involves many subject matter experts for each language to produce something that you will hear on the exam and which you may think like, oh, this was a normal dialogue that I heard just yesterday on the job. That's the intent, to create something that is very close to your job and is not something that is more than what we say we're testing. So the information about the logistics and the preparatory materials that I will be referring to the rest of the presentation, you can find on our website. The easiest way to go is if from the navigation tabs you select the tab community and then select the second bullet, healthcare interpreter, and here you'll get to this landing page which has a lot of information from how to find the test center and what is the schedule, how to prepare for it, and all these documents listed there, including this webinar information will be as another bullet here on this page. by the beginning of next week. I encourage you, if you have not read by this step the candidate's examination handbook, please do so, because it does explain the scoring, it does explain what the exam consists of and what to expect at the test site, how to communicate with us for different reasons. We are updating it. Some information that I am talking about today is not available yet in this handbook. It will be within a week or so, and then that version will change from October to April 2018. With that, let's situate ourselves. Who is the exam for? What we always say, that our certifications that we currently administer are for entry-level healthcare interpreters. This is important. We chose this approach specifically because we understand that entry-level interpreters do a very important job, which is very complex. And entry-level doesn't mean that you're an interpreter who cannot interpret accurately. Entry level means that you can perform your functions competently, independently, and unsupervised in any setting and any modality. How it applies to this exam, in other words, is you still have to be able to interpret everything without omissions, additions, substitution in a culturally competent manner. We chose the topics that are very basic and very common across our profession. We also chose the difficulty of the language, which is appropriate for entry-level interpreter. In other words, there will be no difficult terms of the exam that in real life you would usually ask the provider or the patient to clarify. On the exam, we understand because you don't have that ability, we have to make sure that the difficulty level of the language is appropriate, and that appropriateness is ascertained by these groups of practicing interpreters. Believe me, when we have these conversations, they will say, oh no, this term is too hard, many interpreters will not understand it, then we remove that term from the exam. We only keep the most basic terms in healthcare that you need to know, because the main purpose of the exam to see how can you interpret from English into Spanish, Arabic, or Mandarin, not how many words and terms you remember, because we understand that you can always clarify the term on the job, and also nobody can know every medical term, right? So just a quick overview, bird's eye view, and then we'll dive into details about the exam. It is computer-based. Just because it is national and we want to make sure that it is available for interpreters in different areas, the easiest way to do it, the cheapest way to do it is through computer. Because if we had to rent a room to have, the equipment there and all that stuff, it would have taken us, and we collected papers or recordings of discs, it would have taken us much more resources, and so it is a computer-based exam. It is obviously dual language. In other words, there is English and there is the other language, Spanish, Arabic, or Mandarin. The exam requires 7 oral responses from you, and there is 1 multiple choice question where you just choose the correct answer. You have 1 hour to complete all the tasks, and the testing is done 4 times a year. Kind of mid-January through mid-February, April, May, July, August, and October, November. And the schedule is available on our website for the full year, so you can plan your time accordingly. Each testing window is approximately 3 weeks. Exams take place in a private room, and for that reason, we have a somewhat limited number of testing sites. But we do add testing sites continuously. At the same time, when we realize that, let's say we contracted with a test site, everything was worked well, and then they changed something and they don't have a good internet connection any longer, and for that reason we remove those test sites. So I always encourage you to check your test sites periodically. If it is not available in your location, it may be available for the next testing window. And also don't assume that the same testing site is available for next testing window, because if there were any technical problems with that we could not fix, we will remove that testing site and look for a new location so that your experience is most appropriate. Scores for the exam, unlike the written exam, are available after 6 or 8 weeks after the last day of testing window. And I'll explain to you why, because it is scored by human raters and it involves many more steps than what the written multiple choice exam is like. So what is on the exam? We have 4 tasks or 4 subdomains on that exam. The 70% of the exam content and your score is about interpreting consecutively. That's the percentage that was we arrived at after the job task analysis result. That national survey said that on the job, most of the time, collectively, in different states, different environments, we interpret consecutively. I know some of you may always interpret simultaneously, but that's what the beauty is of that national survey, that we arrive at something that represents the whole profession and not specific area or group. 14% of the time we interpret simultaneously, and that's what our exam represents. And then we have sight translation. We have 9% of your final score is about sight translation. We also, of course, understand that in some institutions and some big hospitals, sight translation is not allowed. However, again, nationally, responses show that sight translation is done. And translating healthcare documents, again, this is a written translation skill, and we are interpreters. We also understand that theoretically, in the ideal world, we should not be doing translation on the job, but the job task analysis in 2016 confirmed that we are still asked to do it, and we do it. Right? For that reason, if this is the results of the job task analysis, we have to have it on the exam. In the next job task analysis, which will be what, in 2021, right? 5 years from 2016. If that survey shows that interpreters no longer do sight translation or written translation, then we will drop that from the exam. That's the importance of you participating even after you become certified in those surveys, in those studies, so that we could keep the exam current and relevant to what is going on in the field now. We also have a task that is not really a mode of interpreting, that is about maintaining fidelity to the message. In other words, interpreting everything accurately. And that task is assessed in all these modes of interpreting. And in our examination specifications, when we defined what you need to know to be able to perform that task, we separated that we need to have the knowledge of our capacity for retaining and recalling information, right? In other words, in order to interpret accurately, you have to remember certain things, right? You need to have a command or knowledge of terminology, idioms, usage, and cultural significance of certain linguistic phenomena. And then we also need to have the knowledge of the linguistic community, so you interpret words appropriately for both the patient and the providers. In addition to the knowledge to perform that task accurately, you need to have certain skills. And these are the 4 skills that subject matter experts identified. Self-monitoring for accuracy, because that's what kind of makes us professionals, that not only we say things, but we actually are listening to what we're saying. And if we catch a mistake, we will correct them. In order to be able to interpret accurately, you need to be able to research your unfamiliar or emergent terminology, evaluate the validity of the resources, because if, for example, there is a outdated dictionary that says that this is how you would interpret MRI, but you know that nowadays they call it something differently, then you need to know that the validity, to be able to ascertain how valid that resource is, or if you're doing the online search for translating a certain term, you need to understand that certain websites may not have the same validity as websites of medical schools or associations of medical professionals of specific specialty. And then you need to obviously have the skill that was broadly defined as interpreting without additions, omissions, or substitution. That's that elusive skill of converting the meaning of the speaker in one language into the message that the listener in another language will understand the same at the same level that a listener of the original speaker will understand, right? That's a very complex skill, and we're getting at it through different means, right? Ultimately, the final score reflects your ability. Can you interpret accurately without omissions, additions, or substitutions or not? How we do it is through the following components on the exam. There are 4 consecutive interpreting vignettes. In other words, they're bidirectional dialogues where between a healthcare provider and a patient or their family member. And you will be interpreting from English into Spanish, from Spanish into English. Then we have 2 simultaneous vignettes, unidirectional. In other words, they're short monologues of a person. One vignette is in English and one vignette is in Spanish, Arabic, or Mandarin, and you're interpreting it simultaneously into the other direction. Then we have site translation component, which consists of 3 brief passages from documents that are appropriate for site translation according to the national guidelines established by NCIHC. So these are presented in English, so you would be recording your site translation of these documents into Spanish, Arabic, and Mandarin. And then the last section of the exam is your testing of translation skills, but we understand that we cannot really directly test it. First of all, because the percentage of the value on the exam is pretty low, right? 2%. We should be cautious of, not making it too prominent a part of the exam. But secondly, real translation includes typing it out, right? Which is keyboarding skill. In healthcare, when you do translation, you're not typing it out. You're writing down a couple of sentences for the patient so they can refer to that note when they are at home and they have it in Spanish, Arabic, or Mandarin. So on the exam, we cannot really ask you to handwrite it or even keyboard. Each person has different speed, etc. So we test that skill indirectly via multiple choice. And I'll talk about that in more detail. So let's talk about consecutive. What we have there is a dialogue. There are 4 of those dialogues. Each dialogue is up to 24 utterances, usually around 18. And that's a conversation typical for an appointment, and an utterance is not necessarily a sentence. It could be something like, good morning, my name is Natalya, I'm so glad to see you, I have good news for you. That's one utterance, right? So you will hear that recording in English and you will need to interpret that into your language. You can play each utterance a maximum of 2 times. Obviously, one thing I want to mention, that you cannot pause the utterance in the middle. You have to listen to the whole utterance. But they're very short, somewhere between 2 to 10 seconds long, right? That's how long the utterances are on our exam. But you can replay it. However, keep in mind that you are in charge of monitoring your time on the exam. You have 1 hour, and the only timed portions is how many seconds we allow for you to record your answer. Everything else in between is controlled by you. So if you keep replaying easy utterances, then you're wasting your time, and you may not have enough time to finish the exam when you get to the sight translation portion of it. So please manage it judiciously. Anecdotally, I can tell you that roughly at around 40 minutes into the exam, you should be done with your consecutive, because there are, these are the most important parts. And then if you're done at around 50 minutes, you still are able to finish the exam, but you'll feel rushed, right? But 40 minutes is comfort, and that's what the majority of candidates do. However, there are candidates who, end up at about 50 minutes, then they still have the time to 5 minutes for their simultaneous, and then they only have 5 minutes for sight. That's cutting it short, but possible. Simultaneous vignettes are very short. We have two. Each one is only up to 2 minutes long. That's the good news. That's why I'm saying 5 minutes is enough for your simultaneous, because here you will press just one button, which says play record. And as soon as you press, you should be mentally ready for it, right? So you're ready that this is simultaneous. As soon as I press the button, I will hear somebody speaking in English or in Spanish, Arabic, Mandarin, and I will have to start recording myself within 10 seconds. And as soon as you hear the first meaning of unit of meaning, you need to start interpreting, because you are given certain time after the speaker stops talking to catch up, but that's lagging behind time is not very long. So 5 minutes is what you will take on simultaneous, and that's pretty much the only section of the exam which is kind of controlled automatically. Everything else is up to you, how much time you spend between pressing play and record buttons. That's totally under your control. You're not allowed to replay it. You're not allowed to pause simultaneous. When you press that button, you just have to say something, right? Hopefully interpreting correctly. Sight translation item consists of 3 short paragraphs, and on the screen you will have only one paragraph displayed in English, and there's one button, record. So these 3 paragraphs represent healthcare documents that are about these 3 types of documents you see in hospitals: patient educational materials, institutional materials like intake forms, and then quasi-legal or legal materials, something that patients have to sign, right? These are pretty short excerpts. They are about 3 sentences long, so they definitely are very representative, and they're not written by experts. They're selected from real documents. So what we do for the exam, we just grab different documents from different hospitals across the country, and then subject matter experts select paragraphs that are meant for entry-level interpreters. In other words, they don't have terms that are too complicated. Then in a real life, you would ask the nurse to explain that paragraph to you before you would be sight translating it. So again, these are pretty simple standard documents that actually exist in healthcare. The last part that is the written translation question, it's a multiple choice question where you have an English excerpt, again from the real document in healthcare, and 4 options of its translation into Spanish, Arabic, and Mandarin. So out of those 4 options, you need to make sure that you select only one correct translation. And we know there's only one correct because there are mistakes of the other 3. Keep in mind that the correct translation preserves the lexical equivalency, including the register of the text and formality of it, and follows the syntax and grammar and the form of the text closely. In other words, there are no grammar mistakes or syntax mistakes in that text. So in general, it is an easier task because you're just reading and selecting the options. You're not actually producing the speech. Um, I know many of you have questions about, all right, so you have the exam for Spanish, Arabic, and Mandarin, but there are different versions of Spanish, Mandarin, or Arabic, or different versions of pretty much any language, different versions of English. So how do you deal with these regional variations? Well, first of all, job task analysis results tell us that one of the tasks that any interpreter of any language must be able to handle on the job is to understand different or various regional variants of patients. So for that reason, when we construct the exam, we cannot just have one person speaking Spanish, whatever that happens to be, Mexican or Honduran or Argentine, record all the recordings for our exams. We specifically seek different voices, different accents, so that indirectly we check your ability to understand different people who speak your language. And we also understand that there is a huge difference between different Spanishes, and I know I'm kind of making that word that doesn't exist, plural in Spanish, and different Arabics, because again, what a different spoken Arabic is completely linguistically different phenomenon than the regional variation of Spanish. We understand that, but exams are always approximation of reality. They are not reality, and you need to be prepared for that. That's why we're explaining this to you ahead of time so you know what to expect. So one of the ways for us to address these regional variations was from the very beginning when we had this subject matter expert group, experts write the exams in your language or adapt them from English to your language. We wanted to make sure that in the group we have interpreters representing different countries, different regional variations of your language, and also interpreters for whom your language is not native. In other words, in the Spanish group, we have uh, uh, interpreters for whom English is the native language, as Spanish is an acquired language. So there is no bias towards how you acquired any of the languages when on our exam. It is, I'm honest with you, it's really hard, and I don't know if in this way right now in the review process of Mandarin and studying Arabic next, I don't know if we'll find any subject matter experts who meet all the criteria and for whom Mandarin or Arabic are not native language. We may not be able to find those, but for Spanish it is relatively easy. Also, our raters represent different regional variants or dialects of Arabic, Mandarin, and Spanish, because again, we want to make sure that during the rating process there is no bias towards a specific regional variation. And before I go into any other details about that, let me give you some definitions so we all using the same meaning when I say certain words. So first, dialect. By dialect, what I mean today and what linguistics usually means is it's a variety of language used recognizably by a group of people in a specific region, geographic region, or of a specific social division. That's what dialect is. In other words, in Russian, my dialect is Southern Russian. That's what my dialect is. In American English, my dialect is Midwestern because I lived most of my life here in Ohio and Michigan. Regional variation. This is either a dialect, just called a synonym of it, right? Instead of using the word dialect, we say a regional variation. But it could also mean that it's a group of similar dialects for a larger geographical location. For example, instead of saying Salvadoran or Honduran or Costa Rican Spanish, we can say Central American Spanish, right? For Arabic, we can say that this is Gulf spoken Arabic, which encompasses several countries, right? Or, but that's what we mean by regional variation. It could, and that's what I will use it in this context. Regionalism is a word that is used only in a specific dialect. Give you an English example, the word pop, that's what we call soft drink in Ohio. If you go to Texas, you would call it Coke. But in Ohio, pop is anything. Coke, Pepsi, anything is a pop. Mountain Dew. That's a word that is regionalism. And then accent. Accent is an element of a dialect. It's a distinctive mode of pronunciation associated with a specific locality, social class, and nation. So that's what we mean by the word accent. So accent is part of dialect. And then these kind of four terms are very closely related. And then the fifth term is completely different from these. Register. What we mean by register, it's a variety of language used in different situations or for different purposes, which are identified by the degrees of formality. In other words, register is how a speaker chooses a word, whether it's a formal word or if it is an informal word. And each dialect has different registers, because think of it, in any language, in any regional variations, when you speak to your respected elderly, you will use higher register or formal register. And when you speak to a child or a person who is below you by social status, you will use an informal register or lower register. So clarifying these definitions for a reason. The interpreter's task in real life and on the exam is to keep the register of the speaker, because that's what we can do. The interpreter's task is not to keep the dialect or accent of the speaker, because as human beings, we can only speak in the dialect that is ours, or we sometimes could master two dialects if we lived, let's say, 20 years in Jordan and 20 years in Morocco. You will be able to equally well speak Moroccan spoken Arabic and Jordanian spoken Arabic. But if you're not like that, even if you have been exposed to Moroccan, but you are from Jordan, you'll be able to understand the Moroccan speaker, but you will not be able to speak Moroccan. You may know some regionalisms, some words, but you will not be able to really produce that language. And for that reason, on the exam, we don't ask you to reproduce the accent or the dialect that you may hear of the patient on our exam. You need to interpret into your own regional variation of the language. So speaking, when you interpret from English, right? Doctors' words, nurses' words on our exam, you interpret in whatever is your version of your language, be it Lebanese, Mexican, or Mandarin Chinese from Taiwan. The key here there is you interpret it still accurately, right? You maintain the meaning, the register, and the correct grammar of Spanish, Arabic, and Mandarin language. You're not changing that. But you don't need to worry that, for example, in the consecutive dialogue, you heard that the patient was speaking Mexican Spanish. Don't worry what you heard. The purpose of that was for us to see, could you understand a Mexican speaking person? But you then interpret things for your exam. If you are from Chile, you'll interpret it in Chilean. We also understand that it's slightly more complicated for the Arabic speakers, and I'll talk about it in a second. But what's important when you interpret from English, right? Doctor's words, usually, including on our exams, are more formal. There are some informal things, so it's important that you keep the register of what you hear. If there on our exam there is a doctor who speaks in relatively formal English, you need to keep that level of formality when you interpret it into Spanish, Arabic, or Mandarin. If you on our exam here, let's say a doctor you trying to use some, you know, informal English, honey, is it hurt? Is this a boo-boo? Something like that, right? Then you interpret it into your language using the same level of informality. Especially it's important when you interpret your site translation section, because those are written English documents, which by definition are formal English. formal written English. So you have to interpret them into formal language of which you're speaking. So for Arabic candidates, what it means is when you interpret a formal registered English word, you may have to use an MSA word, Modern Standard Arabic. I know it is the version spoken only at diplomatic level or news, but at the same time, it is something that's understood across the whole spectrum of the Arabic world. And because we created one Arabic exam and not 5 or 20, and we cannot create 5 Arabic exams. We have to agree, and that's what our agreement is with you, that when you're hearing the formal English, you will use a formal MSA word or a word typical for what is called by some linguists educated spoken Arabic. That would be spoken Arabic of your country, of your region, but educated level. So it has to be reflecting the formality of the English. That's the key that may have you confusing that, oh, which dialect and how it affects your score. As long as you keep in mind this, you'll be good as far on your regional variation. But a few words, what if you're interpreting into English? In other words, how different is the Spanish, Arabic, and Mandarin on the exams as far as the words of the patients are concerned. So the content is presented in different regional variants on purpose. We have voice talents with different accents that recorded that content, and that's again done intentionally, as I keep saying, is so that we can ascertain whether you're able to distinguish between different accents. And I understand that Mandarin Chinese from China, northern dialect, is very different than southern dialect, and if we're adding here Taiwan, if we're adding here Hong Kong, or Chinese speakers from Vietnam or Malaysia, we get all kinds of variation. But it is important for us to know that in real life, when we say that you're able to interpret in any setting and for any person speaking that language, that you really can do that. And that's how we test that ability. But as far as the actual content, we don't have many regionalisms in the exam. If we have a regionalism, it could be just because there is no way of saying it in a non-regional way. And if we use these regionalisms, they're the ones that every entry-level interpreter should understand and should study to understand it. I know there are different ways of saying banana in all of your languages, or a word cookie, or a word snack, right? For that reason, when we created the exam, when the raters are having their meetings and saying what cookie we will accept, the default is, as long as it's cookie in some country, and it's not a cake, then this is the correct version. So again, we don't have many regionalisms, but you may hear the patients saying the word cookie that usually is pronounced that way or is used in a specific country and not in another country. But they're only these very basic words that regionalism. And if I, remember correctly, there may be like 2 or 3 words on the whole exam that again are meant to test your broad understanding of dialects of your patients. Now, as far as the Arabic exam is concerned, it is presented, it was written, and we asked the voice talents to read it in Modern Standard Arabic and MSA. Without any regionalism to the extent possible. But since you're Arabic speakers, you understand that sometimes it's simply also impossible. So the accents that we use on the test are Egyptian, Iraqi, Lebanese, and Jordanian. Well, standardized by the way we ascertained that was by subject matter experts from different countries listening to it and just saying that, yeah, even though I'm, let's say, from Libya, I still understand this version from Iraq. It's neutral enough. I can hear it's Iraqi, but it's understandable Iraqi. So that's what I want you to keep in mind, that this is the consensus of several groups of people, that this is understandable. and the same thing for Mandarin and Spanish, of course. Um, and I see a question here is, can we use more than one dialect on the exam? Absolutely. I know we're nervous on the exam, and you may, attempt to start it interpreting in one dialect and then you jump to another, especially for Spanish interpreters. If Spanish is not your native language, if it's English and you've interpreted to different kinds of patients, you may tend to, if you hear a Mexican patient on the exam, to use more Mexican versions when you interpret that portion, and then you hear, let's say, somebody from Peru on the exam, you will change your Spanish a little bit. You're not penalized of which version you used or how many times you switch back and forth. As long as you keep the integrity of the message, you are in good shape. So we have several resources about how to prepare for the exam available on our website. The easiest way to find them is from any page on the footer. Look for that second column, last bullet, certification resources, and you'll get to the page which has different things, including the CHI exam specifications that I just referred to, these percentages with more description of the skills and knowledge available. So this is what the page will look like. You will have here the study checklist, and it's a one-page document with different links. Please review it before your exam. We also have CHI practice exams available free of charge on our online training platform, and I will talk about that in a second. We also have mini glossaries, which are free, but you'll need to submit your name and email, and then you get a confirmation email with the link to the glossaries, and then bookmark that link. There is no sign in, there is no password. It's just that we email you a link after you sign up. And then other links, external links with different medical terminology. As far as that online training portal where we have our practice exams for both CoreCHI and all three oral exams, first it's a different website. It's http://cchiinterpreters.org without www. This is a different website. Your application is not here. It's not our regular website. Its whole purpose is to have different resources like practice exams available. So when you create an account there, make sure you write down somewhere username and password. It's not a bank. It's not that confidential, seriously. We do have there some courses that are for a fee, but they're done through a secure PayPal checkout. In other words, nowhere on our site we store your information about a credit card. So really, it is truly important that you remember username and password. Of course, if you forget it, you can always email us. There is a function there, but that's a function monitored by humans. It's not automated. So right now we average about 72 hours to respond to those requests. But if you hit holidays, it may be longer, right? So it's important that you try to remember which username you create for which website of CCHI. So after you create that account, log in. It's at the very top here of the website screen, right above our logo. And when you log in, you will see these practice exams. These available courses that different titles. What you do is you just click on the title or the image, and you'll get to a page which will describe this course and ask you to enter the enrollment key. We have it listed right here, and it's study for you, capital S, and you're able to take the exam. What the important thing about this practice exam is to have and we have instructions there, recording device available, because what you will have there are a couple one sample of consecutive vignette, one sample of simultaneous, and one sample of site translation items. And these will be the recordings, and you will have to record yourself. Then you click next. It kind of gives you a similar experience that you will have on the exam. Slightly different look, but it's the same principle. Buttons next and how they are described. And then we give you some tips tips on listening to your recording. Let's say you recorded yourself on a cell phone, so you get to the screen which gives you the correct interpretation, and you can listen to your recording and compare those. Then we also give some tips for how long it should have taken you to record that simultaneous or sight translation. So you can practice if you discover via sample exam that you're too slow. That pretty much means that on the real exam you will be slow too, right? So make sure you practice, because every skill is practice, practice, practice. And if you have these guidelines about the timing, then you'll be better prepared for the actual exam. There is no way around of making the timing comfortable for everybody. It is timed for a minimally competent candidate. In other words, the ones who are going to pass our exam with a minimal score, which may unfortunately be not, how you usually speak in real life, but this is to accommodate all candidates, not just one. If you already have taken one course from that platform, I just want you to show you this little thing that you will, when you log in, you'll see my courses, and you'll think, oh, there are only 3. Where are the others? Well, they're hidden under this little link here called all courses. So you need to really then click on it, and it'll unfold and show you other webinars that we have there available as continuing education. But you can also take them as part of your preparation for the oral exam. So let's talk about how you're going to prepare for the exam. First thing I recommend you do is write down the list of healthcare specialists that come to your mind, all of them that you see in hospital as a patient and as an interpreter, and start with the specialties that you are interpreting most often for. For example, if you're if you a staff interpreter at Children's Hospital, then you would put your, baby well baby or newborn baby checkup appointment, or then you can go is developmental appointments, appointments for diabetes, that kind of stuff. So just look, you can write it out as a type of appointments or a type of departments in the hospital or clinics. Then the reason I'm saying starting with the most convenient, I mean, the ones that you interpret most for, is because it's always better to start practicing with the things that are simple, that you can actually see your success in, and then progress to more difficult subjects, because the exam level is entry level, so you're not going to be interpreting for neurosurgeons on our exam. So you need to really start with the there may be a neurosurgery consult, but it won't have any neurosurgeon specific terminology there. So after you defined what are the subjects that you want to review, and I understand there will be about, maybe, I don't know, 25, 40 of them, right? Find YouTube videos on these subjects. YouTube videos that are presented by healthcare professionals explaining these topics, and by patients talking about the experience. Oh, yesterday I had a surgery where my gallbladder was removed. This is what they did to me, that kind of stuff, right? So that's why YouTube is our best friend. Make sure you find them in both languages. And so what you need these YouTube videos both to practice the interpreting and to learn about those specialties that you're not familiar with. It will be much faster than if you're trying to read, because you need to have the audio oral input. That's what we are, interpreting oral speech. So it's important that you include that audio input when you practice. Also, find healthcare documents from different departments. Collect them from your actual job of place of work, but also do online searches for different kinds of waivers, intake forms for different departments, right? Patient educational materials, which are usually about some conditions or procedures. Because again, on our exam, we have excerpts from the real documents. So the more you find and the more you read and interpret, or sight translate in this case, the better you are prepared. There are some practice textbooks with dialogues, not too many, but there are some. You can do the search like English, Spanish interpreting dialogues, something like that, and you will find a couple of them there. And then record yourself. Be prepared to have a device, use a phone or tablet, or if you use a laptop, make sure that you always record yourself practicing interpreting. I'll explain you how to do it in detail. If possible, it is ideal that you work with a partner, even if they're a different language. They at least can help you, either read things for you in English or give you feedback about your English interpretation. Ideally is that you're practicing with a interpreter who speaks the same language. um, there are different, for recording purposes, there are different phone recording apps. Just go to your Play Store or Apple Store and you find them. If you're using desktop, one of the widely used applications is called Audacity. It's a free download, and then you have your USB headset and you'll be able to practice interpreting anything. Again, the reason you want to have it digital, either phone or laptop, is because you'll be practicing with YouTube if you're doing it all by yourself. So start always with pre-interpreting exercises, mixing and matching different topics, right? Or it could be one exercise will be about cardiology, the other exercise will be about ophthalmology. This way you're killing two birds with one stone. You're reviewing that subject matter, right, specialty, and you're exercising your interpreting skills. The most important part for us as interpreters is to understand the source text or speech. So you think you make mistakes because of something else, but most mistakes come because you misunderstood. Either you were too panicky, you were in a hurry. That's what happens on the exam, right? Or in real life, you just misheard it, and then you ask for clarification. But it's understanding that produces accurate interpretation. So we'll start with those exercises. What are they? Text analysis. In other words, try to, if you're listening to a speech, parse it or chunk it into different units and then retell this unit by unit. Identify how the logic of the speech flowed or the text. Distinguish what is the crucial information, what is the secondary information. Remember how I said in the beginning, omissions have different value? That is what these exercises will help you to understand. Of that speech, what is the absolute minimum that you have to interpret for it to be understood for a patient and doing for them to do the right job, and what things you can omit. Yeah, you won't get the high score on the exam, but at least this exercise helps you distinguish these things, and when you start actually interpreting, your mind, that because it's used to it, automatically will focus on the most important things and interpret them. And if the mind has the bandwidth and the time, then it would also interpret everything else. But the practice needs to be with focusing on the key meanings of the text or the speech. Memory development exercises. Practice both. Remembering longer segments. You start practicing, let's say you take a YouTube video and you pause the speaker after one sentence and then you interpret it, right? Then you're doing a second time the same video where you pause the speaker after two sentences and interpret it. Then after three, that's how you expand your capacity, right? You retain longer segments. But you also need to practice how you clear your cache. In other words, how you forget things quickly so you don't. That's what's important for simultaneous interpreting, that you're able to move on, and if you got too far behind, that you can stop, take a breath, and continue interpreting without being disturbed that you forgot something. Attention span increase. That's another thing that you need to practice. Practice to listening first to videos for 2 minutes and interpret them, and then maybe 5 minute ones. Concentration. Try to distract yourself with different things, be it music, be it tapping on the table, or trying to I don't know, multitask. We all know what multitasking is, but that's what improves your concentration. And comprehension, reading the text and identifying key points or summarizing it in a manner that is able, to get the main idea across. And then processing speed. That's just, you interpret the same thing once, you see how many seconds you took, then you interpret it again and see how your time will be decreasing, and you'll be able to interpret faster and faster. Yes, because you know that speech better, but it also helps you to speak in a manner, that would be very helpful to you on the exam, because you are used to working in an efficient manner through these exercises. The second type of exercises are actually about delivery. Those were about your cognition or comprehension. Now these are about delivery. Paraphrasing is a very important type of exercise to practice. Do it intralinguistically, in other words, English speech, paraphrase it into English, and focus on meaning, not on words, because interpreting is not about words. Interpreting is about intended meaning. Simple as a piece of cake, right? You're not interpreting a piece of cake, you're interpreting simple. So that's what you do when you paraphrase in English. And then you do it interlinguistically. In other words, listen to the video in English and paraphrase it in Spanish. Intentionally don't interpret it accurately. Intentionally. That's the key, because this will help you engage so many other brain activities that will improve your interpreting in general. Summarization in source language, target language, again, helps you with delivery. Source language, like, you heard the video in Spanish, you summarize it in Spanish, and then you summarize it in English. What you're doing through all these exercises, because you're matching and mixing topics, that's how you also are doing a very effective and efficient review of terminology and the subject matter in those topics. Because memorizing terms is impossible, but this way you're focusing on the skill, and your background activity is actually understanding the topic better and better with each time you practice it. Record yourself prepared presentation or improvised presentation speech. Just give yourself an assignment. Today I will talk about most common interpreting in uh, urology, and just start recording how you say it in Spanish and how you say it in English, right? And then you compare these two recordings, and you will be able to see which sounded better. And that would give you an idea of which language is still your weaker language, and you may need to spend more time practicing in that language. Do the same thing with prepared. In other words, read a couple of texts about some specialty, let's say cardiology, let's say very specific stress test, nuclear stress test in cardiology. Read 2-3 articles, and then produce a speech and record yourself talking about nuclear stress test in English and in Arabic. And again, see which was easier, and that will give you a clue of what you need to practice more of, which language in that pair. Language transfer skills could be improved through reading different subject topics and listening and viewing videos in both languages. And then for simultaneous interpreting, try practicing what I call shadow with paraphrasing. You're listening to an English video without stopping it, and what you're doing, instead of repeating the exact word of the speaker, you're paraphrasing them in English. You're not interpreting, but paraphrasing them in English. Kind of like what you're doing when you're retelling the story your best friend told you on the phone, when you call the next friend and you tell them, guess what I just heard? And then you retell it, right? You're paraphrasing, and do the same thing, but intentionally. First, do it as close to the speaker as possible, but then try to lag behind more and more. At the same time, keeping the speaker's intonation and prosody, in other words, what emphasis the speaker does, and their pace. These kind of exercises will help you with your delivery, and if you're doing them even a couple of weeks before the exam, again, it sounds like it's like a year work of work. Yeah, you can spend a year, but that's a lifelong journey. You can continue this exercise after you get certified. But even if you spend 2 weeks before the exam, doing these exercises for 1 hour a day, you will be better prepared than if you decide to do something else. Now, as far as how to exercise, this was what kind of exercise, how to exercise. Do the same speech or the same text in 3 attempts, because our human brain kind of needs breaks to really get it. So do it at different times of the day, because we don't really choose when we're testing, even though we do, but still you may want to test at 10 a.m. in the morning and the only slot available is at 3 p.m. in the afternoon. So if you practice at different times of the day, then the time of the testing won't affect you physically in different locations, because testing center is different than your home or your work. So if you will do practicing as like, now I'm going to sit and practice simultaneous interpreting first in your bedroom, then in the cafeteria at your work, and then when you're riding a commute train to your work, when you come to the test site, the fact that it's a new room, a new environment won't affect you psychologically and won't add stress to you. Use a soft background music of your choice. Scientists did different studies, and it really doesn't matter what you play. It can be punk rock or it could be classical music. Yes, there are some better classical music examples that help you supposedly to retain certain information, but you're practicing. The purpose of the music here is that's the second multitasking that helps your concentration and also helps you to ignore what's going on around you. And that's why when you're on the exam, if somebody coughs, you won't really care because you've been prepared through your exercises to have different background noises. I know we're cutting very, I'm talking a lot in detail about different things, and we're past our first hour. Good thing is that this webinar is recorded, and I will try to finish everything else in a shorter period of, in about, 15 to 20 minutes. But please come back to the recording and listen to it if you need to leave at this time. So make sure that when you do the rest day, when you have your rest days between interpreting, you either do it some pre-interpreting exercises or choose a different topic. What you need, the timing of the breaks between practices are also important. So do the same speech or text in 3 attempts. On day 1, your step first, interpret it consecutively and record yourself. Listen to your recording, compare to the original, see if you identified the errors. Second step, in other words, skip a day. Second step is on day 3 and 4. Listen to the speech again and do paraphrase shadowing. Search for other texts and videos on the same topics, read about that subject matter, look up terms that you don't know and what their correct translation is, retell it in the 2 languages as close as possible, summarize it in the target language. Then give yourself another break, and on day 6, interpret that speech consecutively again, record yourself, and compare with the original and see how many mistakes you made then. Because by this 3rd step, you should pretty much have gotten the content good and your delivery should be much better. If you still have many errors, then we'll move to steps 5 and 4. If you don't have many errors or they're very insignificant, then repeat the same steps but doing the same speech in simultaneous mode. Then steps, what if you had many mistakes? The step number 4 becomes find a different speech but on the same subject and do the same things, right? After you've done that on day 17, that's your 5th step. You interpret speech A again, that first one where you had too many mistakes still, and listen to your recording. And if you still have errors, then you need to make a very serious assessment of yourself. There are 2 things that are happening. One, maybe the subject matter is so different to you that you don't know enough. That means that you need to study that subject matter, be it cardiology or whatever. Or that simply your command of either source language or the target language is not good enough, and you need to spend, before you take the exam, you need to spend some time to practice more of that language. That I don't think many of you will get that kind of result, but some of you might. And don't, be afraid to recognize that, what, I'm simply not ready yet. You have 1 year to take the oral exam after you pass the written. And that means that you have the time to improve. The key is you can only improve when you know where your weakness is. So what this way of practicing helps you with is identifying what are your weak areas. When we come to the sight translation part of the exam, it's important that on the exam you're practicing the correct same steps that you usually would do in real life to produce accurate interpretation. In other words, quickly skim over the document to get the general idea of it, right? It's a very short paragraph, to see if there are any uncommon, unfamiliar terms. By that time, you have about 10 minutes left on your exam. You have 3 passages, each about 3 sentences long, so you have your time. So if you see that there is some term which you simply don't remember at this moment or have never heard of, which is very rare, but it's possible, then think of how you are going to interpret it. Because you still have to interpret it on the exam, right? How? The worst case scenario, you leave it in English. The best case scenario, you describe the meaning. Kind of you know the meaning and you describe it. You just simply don't remember the actual word for it in your language. So, but you need to make that decision first. That's what that first step of skimming over the document is for. Then also, don't rush to press the record button on the exam. Formulate in your head what you're going to say. So when you press record button, you actually are producing a cohesive, grammatically correct sight translation of that document. When you're interpreting, focus on going idea by idea, not word for word. Remember that in sight translation, you are allowed to change the order. You are allowed to break long sentences into shorter sentences. As long as you keep the meaning, you can play with the syntax and word order in sight translation. And for that, you need obviously time. So that's why 10 minutes, that's how much you should have for that. You should have for your section there. 5 minutes is still possible. 2 minutes, you will not be able to finish it. Just giving you guidance, not scaring you, just giving you guidelines of when you see the timer, what that timer should mean for you. Again, though, remember that the 75% of the score in consecutive, if you did perfect consecutive, theoretically, you need just a few points on sight to pass the exam. However, practically, I can tell you, nobody does perfect on any of the exams because it's a stressful situation, right? We're adults, we're always stressed by tests. So be prepared that you really need to have time for your sight translation. As you're reading the first sentence of the sight translation, let your eyes move forward and read ahead so your brain can prepare what to say in Arabic, Mandarin, and Spanish in that place. And go at a moderate and even pace. It's very hard to follow the meaning if you are, kind of doing the jerky intonation, etc. And as I will say about the scoring, we do assess your quality of speech on our exam. So logistics briefly. Don't schedule the exam before you get the email with a notice to schedule for CHI exam. That usually comes within 9 business days of your payment for your exam. If you need to schedule, cancel, or reschedule your exam, we have one phone number that it's done by phone. And this phone line is operated by a testing vendor, PSI, that's who is administering our exams. They contract with different test sites. So the test site could say college or hospital, but the actual scheduling and preserving of all the data is done by PSI. When you call, clearly state the name of the exam, that it is CHI, Spanish, Arabic, or Mandarin. Don't call it CCHI. Don't call it Spanish because they have other clients, they will only look for the names of the exams they have on the list. If you say CCHI exam, you will be sent to CoreCHI maybe, because that's the first exam listed on the CCHI. So make sure you name the exam correctly. Tell your personal code. That's why you need to wait till notice to schedule, because that's where you get your personal code as a test taker. And in their computerized system, when you are eligible, that code is there and your name is there. If you're calling and you don't have notice to schedule, A, you don't know the code, B, it's not in their system yet, they cannot schedule you yet. So be patient. Be prepared, because the exam is administered in testing windows, to give 3 preferred dates or times for your specific testing window. The next testing window is April 16th through May 7th. Don't try to schedule for April 15th. They won't do it. Don't try to schedule for May 10th. It's outside the testing window. So within this testing window, tell them any Tuesday, Wednesday, and Friday the 31st are good for me. Well, 30th of April. Good for me between this and this time. The more room you give for scheduling, the better it is. But I understand sometimes you are limited with what you can give. Why is that process is such limited is because, again, you have to have a private room for your exam, and because of that reason, we have very limited spaces available for it. Location of testing sites varies. You can find it on our website on that page that from that page where I showed you, and I'll show you in a second again. But ultimately, when you get to the PSI testing centers, you can do a search for them. If you get to this website, if you click on locations, you will get a list of different clients of theirs. So you look for CCHI, Certification Commission for Healthcare Interpreters. Let's say you're clicking for the state of Ohio, and there you can put your city and how many miles, and you will locate the test center. This information of that link to that website is located on our page called Testing Centers and Schedule. Here is the schedule, and right now I have slightly dated it, but right now it's for the 2018. And here in the middle of the page, it says click here. That would gets you to the search screen for the testing locations for the CHI exam. So when you arrive, make sure you present printed out notice to schedule and your photo ID. Same thing like for the written exam. Arrive early so you can park and find everything within that building. You're not allowed to take anything into the testing center, but you will be given paper and pencil for note taking. Another thing to remember about note taking during the exam, if you have never done it in your life, in real life, take the paper and pencil, but don't focus on it, because you really, even in real life, you're only taking notes for numbers, names of medications, names in general, proper names of any kind. So you don't need to write down anything, and that paper will be destroyed after you leave the room. Proctor will be monitoring the exam, which is good because they will be able to help you with any IT issues. You will have about 30 minutes to see a brief demo. It's not a full dialogue, it's about 3 to 4 sentences. The whole purpose is to ascertain that your headset and mic are working properly. In other words, you'll be asked to record yourself, but what you're looking for is so that on the screen there is the red bar going and the word recording appears. That means the mic is working, and you can set the level volume of your headset to see that you're hearing the recordings properly. This time does not count towards the exam. This is, you can spend as much as, if at this time the proctor identifies that the headset is not working, then you'll take longer until they fix you and you're able to take the exam. After you click begin the exam, that's when it lasts 1 hour. And even if you're not completed, the exam will be automatically submitted with everything that you did recorded. That's why we are, sometimes have some IT issues, because exam is recorded live. And as you can imagine, when you're at home and you're streaming Netflix, you're just listening. What you're doing at the exam, you're doing 2 things. You're listening to audio that is streamed to you from the internet, and you're uploading recording at the same time you're recording to the internet. And that's why it takes more power to do that. And sometimes different other factors could affect how this particular computer at this time works. I mean, 2 hours before you, there may be everything fine, but at this moment something could happen within that building. They may have 10 people doing something simultaneously. So that's the challenge of internet delivery, but it sure is a convenient way of ascertaining that everybody has the same standard environment. You'll be given this headset. It's just simple Microsoft headset with mic. It has this control that we really don't want you to use other than for controlling these two buttons, the volume. You can increase the volume of the audio that you're hearing and decrease it using these buttons. But do not press this button because that button means it's muted. And what happens is kind of something illogical. When you hit mute, this light becomes red. So usually when we have red light, it means it's recording. On this headset, it means it's not recording. So make sure that you're not accidentally pressing that. On some test sites, we specifically disable that button, but not on all test sites. So this is the screenshots of your exam. First thing to keep in mind is your timer right under the logo. Then read these are the instructions. Consecutive interpreting, that means that you are in that section. Then we say where exactly you have vignette 1 of 4. In other words, you're on the first dialogue. What I blocked out here in blue bar is actually a text which tells you what type of appointment it is and who are you going to hear. That will say something like a young male patient is seeing an ophthalmologist, right? Just to situate your brain of what you're going to interpret. It's very short. Then we have here how many utterances are in that dialogue. In this one particularly is 14. The button to play the audio, and you can do it twice, and then the button to record. And when you hit recording, that's the recording indicator bar that actually shows that it's recorded and the word recording appears. If you're done recording before you ran out of time, because when you ran out of time, it will just, stop. But if you're still recording and you're done, then you can click stop and then you click next to move to the next section. When you get to simultaneous, instead of consecutive, you have here simultaneous interpreting on the screen. And again, here will be a scenario telling you that the blue bar is where what it is about. And as you can see, it's one button, play and record. That's when you need to be prepared to record. And here you can see that this is a vignette which only has 70 seconds for you both to listen and to record. So it's a very short vignette. Site translation again is identified like this. There are instructions, and then here you say here is excerpt 3, and then this is the actual text that I blocked out that will have in English that you need to site translate. So read it, and then when you're ready, press record. And here it tells you that there are 45 seconds dedicated to this recording of these 3 sentences of the English texts. And then this is what the multiple choice looks like. You have here the text in English, and then you have A, B, C, D options of text in Spanish, Arabic, or Mandarin. You press one of these buttons that you think is the correct translation, and then after that you click finish the exam. With this type of exam, you cannot go back, you cannot review anything. So after you click record, as I mentioned, there's that red bar indicating that it's going on. Do not double click on any buttons. Do not double click on play record, because what you're doing when you're double clicking, you're moving it to the next step. You're robbing yourself of the replay things. Just be calm. It's normal things. Like every time you click play, it will click play. Don't double click. Do not click back on the browser. I'm telling you, the test cannot allow you to click back. If you click back on the browser, you lock your test. You have to call the proctor. They will unlock it. You will lose your time. Don't do that, right? If you have any IT problems, contact the proctor immediately. Um, when you submit, you press finish. Unlike written exam, you will not get your test results, but we do encourage you, if you had any concerns about your testing experience, please make sure that you write it to us, communicate it to us in writing via email within 5 days. The sooner the better. I would say come back, and if there were anything that was of concern, write it to us. If you passed, nothing lost. If you failed, and if it was related to the IT issue, we'll review it and we'll give you a chance to make sure you have a performance without IT issues. Speaking about the timings and navigation through exam, you cannot move between the sections. You cannot choose. It's a hardwired exam. You have to go next, next, next. There is no choice here. That's intentional because, 1 hour is very well timed. You do have about, between 15 minutes to 20 minutes for you just to think and click. So there's plenty of time for it. But we don't want you to linger, and, we want you to make sure you all have the same opportunity to complete the exam within 60 minutes. That's why there is no back and forth jumping here. So what do you do after? First thing is, because it's audio recordings, obviously it's human rating. Artificial intelligence, thank God, cannot score you yet. Maybe for the next 50, 100 years, right? So you will receive your score report within 6 to 8 weeks after the last day of testing, and I explain why in a second. We also, after that report, within a couple of days, we email you your official score, and that is something where you can always check that email with the official score in your profile. So when you log into the site which had your application, under the communications tab, we have the emails with your scores. So that's where you can check if, for example, 6 weeks passed and you didn't get, I would give it, let's say 7 weeks. 7 weeks passed and you didn't get your email. Most likely it went into your spam folder. So make sure you just log in and check what your score was. How do we score? Well, we have human raters who score the exam by applying what is called behaviorally anchored rating scale, which was developed and validated by the same subject matter experts who developed the whole exam, and under the guidance of our psychometricians. All raters have undergone initial training and then continuously 4 times a year have mandatory training to make sure that they rate the same way every candidate every time. They have each, at the time of hiring, over 5 years of experience as healthcare interpreters. In other words, they know how to interpret themselves. So they're not somebody who knows about interpreting. They actually know what interpreting sounds like and feels like. So raters do not know your identities when they score the exam items. They don't know whether you pass or fail. In other words, they cannot have any interest in passing or failing or even an ability to do that. Each of your oral responses, in other words, 7 oral audio recordings, each of these 7 recordings is scored by 2 raters independently. So potentially your exam could be scored up to 14 people's. They do not see the other raters scoring. So they don't get like, oh, if that rater give you this score, I'll give you this score. No, they simply don't see it. All they see is recording, they play it, they score it, they submit the score online, then they move to the next recording. They also never see your final score. They don't see your full exam ever. Only CCHI staff and psychometricians see the final score. If 2 raters disagree by 1 point, a 3rd rater scores the response. And then we have a formula that takes into account all 3 ratings and produces the most favorable result for you. Total scores are weighted according to our proprietary formula, which unfortunately I cannot tell you, but it follows that distribution of 75% of consecutive, etc. And then it's scaled to distribution of points. Why is it, not very specific? So that again, we measure your abilities and not your ability to take the exam. So your passing rate, your score that you're looking for is 450. don't worry that it's not 500. I am an overachiever usually, but this is the exam that is designed to pass you or fail you. Everybody knows you're certified if you score 450 or if you score 500. Don't worry what your score is, as long as it's not 449. And unfortunately, some of you may get 449. Next time you will practice more and you will pass it, because the score is not arbitrary. It is drawn by different discussions and processes. So raters, when they listen to audio recording, they apply 4 rating scales independently of each other. In other words, they listen to the recording at least 4 times, applying 1 scale at a time, and each scale has the same weight. These scales are lexical content. In other words, they listen to the recording and evaluate how accurately you preserve the units of information of the original speech or text. And units of information could be a unit of information could be an individual word, a group of words, a phrase that communicate one single concept. And on the scales, the errors usually include omissions, additions, or inaccurate translation of that unit of information. Say if instead of left hand you said right hand, that's inaccurate translation, right? The second scale is register of speech. As I mentioned, this is the level of formality. And so what raters do, they evaluate how accurately you kept the register of the source speech, taking into account natural differences between the languages, because sometimes there's certain things that are formal in English, there is no way you can say them formal in Russian, for example, or in this case, Spanish, Arabic, and Mandarin. They know about this. Grammar is the next scale, and it includes a set of rules that govern how sentences, phrases, and words are put together in a given language. And what raters evaluate is your command of grammar of both languages. And on this scale, errors usually include change in verb tense agreement, use of incorrect pronouns, inaccurate word order or syntax in the target language. In other words, if you're interpreting from English into Chinese, right? Your order in Mandarin is different, but you kept the English, you may get some points taken off because you didn't produce the correct Chinese word order on the exam. Quality of speech, that focuses on the physical characteristics of your speech. In other words, your errors here could be false starts. If you started pressed recording too fast and you started saying, today we're going to, oh no, I mean, that's false start, right? You're trying to do it. Hesitations, when you kind of like hesitate which word to say and it's clear in your voice. Numerous self-repairs, when you say something and say, oh no, what I mean this, what I mean is, yes, you should correct yourself, but if you correct it yourself on the exam 50 times, you'll probably most likely get your points taken for the quality of speech, because in real life you're expected to produce reasonably understandable speech without self-correction. Same thing, poor pronunciation of pace that hinders understanding. Pace could be talking too fast. That's so fast that the raters had to listen to your speech 3 times before they understood what you're saying, or talking too slow that you simply ran out of time and didn't record what you're supposed to record it as a certified interpreter. You get the report. This is what it'll looked like. I'll use the past test here for the previous testing windows. So you have your score and you're told if you passed or failed. But we also have the subscores depending on the domains. What will be different starting this testing window is these subscores, instead of 2 categories, we breaking it down in 3 now. Interpret consecutively, interpret simultaneously, and then we keep that last part of written documents together, translate or site translate healthcare documents, that will be together. So there will be 3 scores. We hope this will help you better prepare in case you failed the exam. This you will see if there was a difference in your consecutive and simultaneous interpreting. If you passed, then within 1 or 2 weeks after your score report, you will get the CHI certificate via email as a PDF file. It'll come from this email, orders@brightdoc.com. It's our contractor who does it. If it got into your spam folders, look there first, check your promotions folder in Gmail, but email us if you didn't get it. If, let's say, 2 weeks passed after you got your scores and you still don't have a certificate, most likely maybe your internet provider rejected that email as spam. So we will resend it to you. You can also purchase hard copies of the certificate from that company, and the instructions will be in that email. If you did not pass, you may retake an exam only after 90 days of the date of the regional exam or in the next testing window, whichever is sooner. And you will need to pay the fee again. We allow up to 3 takes within 1 year, just because we understand that you need to practice more if you failed that many times, or also to preserve the integrity of our exams, that you don't really memorize everything. And I want to make it clear that we do have candidates who do take 3 takes to pass the exam. This is normal. Our passing rates are within industry standards. They're different for 3 languages. They're published on our website in the annual report. Last year, the passing rates, sorry, the last available is for 2016. In 2016, the Spanish passing rate was around 75%, Mandarin about 50%, Arabic about 25%. But the reports on the performance of the raters and the items were consistent for all 3 languages. So we feel that this is a natural variation due to the fact that there are fewer educational opportunities that are language-specific trainings with the feedback of the instructor for Arabic Mandarin interpreters compared to Spanish interpreters. If you want to know more about your score than what you see on the report, or you wish to appeal it, please send us in writing your email to appeal@cchicertification.org. And very quickly, you passed the exam, you got certified, you have 4 years that your credential is valid. After that, during these 4 years, you need to make sure that you get at least 32 hours of continuing education, broken down in 2 years, 16 hours every 2 years, and 40 hours of work experience, again 20 hours every 2 years, and then you have to submit 2 applications, and the cost of the certification renewal is $300. I know I took much longer than I expected to talk about this exam, but I really wanted to share with you the tips on how to prepare and for the exam and have a successful experience at the exam.